Good morning, RB, and greetings from God's own country. It gives me great pleasure to present the report of Welsh Council. We've had a pretty good year. We had a new council elected at the beginning of this session, and in some areas, there have been a number of positive developments. In others, of course, there's still a sense of déjà vu. Recent membership surveys have told us that 38% of you feel that system pressures often prevent the delivery of safe care, that 70% of you are regularly working in excess of your normal hours to cover rota gaps, often without adequate rest, and that rota management for juniors and for SAS doctors is still obstructive and inadequate. Doctors in Wales are faced with ever-increasing pressures. Too many beds have been cut, there are inadequate resources available, and the rising workload is becoming unsustainable. There's a constant pressure on emergency departments, made worse by inadequate investment in social care, leading to difficulties moving people out of hospitals and back into their own home. We've questioned the safety of GP out-of-hours services when some parts of Wales have been without a single doctor across a whole health board area overnight. More and more GPs are reporting burnout, and our heat map showing at-risk practices continues to show new hotspots. Overall, 76% of doctors in Wales believe that health services have worsened over the last 12 months. All that said, I did say it's been a pretty good year, and there are clear signals that the Welsh Government is really starting to understand what needs to be done to ensure that health services are sustainable for the future. For the health service as a whole, there's been a parliamentary review published following extensive engagement by the BMA. We were able to welcome many elements, both of the report and the government's response. In particular, we were pleased that the report identified NHS staff as a key asset for NHS Wales, with greater medical engagement, respect for staff, a focus on recruitment, and more consistent commitment to staff welfare, all being promised in the future. We also welcomed a commitment to moving resources to community care, better central direction of health boards, and funds to allow the 64 localities in Wales to develop new innovations. If these promises are made a reality, we could be on the cusp of real and lasting change in Wales. But the continuing lack of concrete funding commitments and timescales continues to make our members nervous. We've seen the birth of Health Education Improvement Wales as an independent NHS body for education. We're pushing it to drive adoption of a single junior lead employer, better arrangements for educational funding, and far more placements for Foundation Year 2 GPs. The Welsh Consultants Committee, led by Trevor Pickersgill, had a very successful first Consultants Conference with an opportunity to hear and question the Cabinet Secretary and breakout sessions on leadership and pensions. 79% of Welsh consultants before the conference said they'd had no training at all to help them agree an effective job plan. BMA Cymru Wales has listened to that, and we're running job planning training in every health board across Wales this coming year. GPC Wales has engaged in an ambitious programme of work led by Charlotte Jones to modernise the Welsh GMS contract. This will be driven by the fundamental desire of the GPC team to create a better future for Welsh GPs, addressing both unsustainable risks and unsustainable workload, but still with a determination to provide the very best care for Welsh patients. We can only hope that our determination is matched by that of the government to fund real long-term solutions. Although it was accepted in 2016, SAS doctors are still waiting for full implementation of the SAS Charter, and I'd like to thank Ram Kumar and Raj Narula in particular for their hard work going out all across Wales to promote the Charter to our members. We're working together with the Welsh Government and the NHS Confederation to become the first UK country to implement a fatigue and facilities charter. It will promote core requirements that minimise fatigue and promote well-being and effective training conditions, which we hope will achieve noticeable improvements for doctors in Wales. I'd particularly like to thank Josie Cheetham and the whole of the Welsh JDC for all the hard work in that. Following extensive lobbying by BMA Cymru Wales, the minimum alcohol pricing bill in Wales was passed just last week, and I thank the Public Health Committee and our Secretariat for all their hard work to promote this success for the people of Wales. On the ground, we've been active in supporting our members individually and collectively. Since January, 100% of our members surveyed in Wales after contacting us were satisfied overall that their concerns have been resolved. We've provided extensive support to Dr. Ray Jakes, who whistle-blew last year on ABMU Health Board. Our call for an independent inquiry was supported both by MENCAP and the patient's family and led to an independent review being ordered by the Cabinet Secretary. Looking forward, there's much to do. Welsh Council took what I hope will be an important step on behalf of members to re-engage with the government, the NHS and other trade unions in the Welsh Partnership Forum. That followed solid guarantees that doctors' contractual arrangements will be kept outside of that forum and that the government would engage in a doctors' forum which would involve all of the employed branches of practice and senior decision makers from NHS Wales and Welsh Government. We hope that this will lead to much closer cooperation with fellow trade unions and more opportunity to influence the direction of NHS Wales and a proper way forward for progressing Welsh negotiations on contract changes where they're needed. Regular engagement with ministers and senior management has been productive and often allowed smaller problems to be short-circuited, and I genuinely believe that that collaborative approach will continue. Much of that cooperative approach follows the adoption of the core principles for NHS Wales, including team working and valuing all staff, and that brings me neatly to the main architect of those principles, my predecessor, Dr. Phil Banfield. Phil from Rhyl. Well, he originally got involved in national politics on the back of concerns about local NHS provision in North Wales and ended up running the show. An academic, he brought a huge amiability and an ability to communicate and get consensus to the job, along with a massive brain and extremely questionable taste in braces. And he's undoubtedly left council much stronger for his leadership over the last 5 years. So thanks, mate. In addition, can I thank Welsh Council and my Deputy Sarah Hunt for their confidence in me in my first year as Chair, and on their behalf, our brilliant National Director Rachel Podolak, and Carla, Lucy, Erica and their teams for all of the hard work they do for all of the members in Wales. And lastly, a personal thanks to our Council Secretary, Sarah Miller, the only person staying between me and chaos. RB, I move.